on from so many different locations and thinking about all the wonderful work that you all are doing. I'm really pleased to be here with you all. It's early in the morning for me, but not too early to be doing this and to be invested in this time that we have together. So thank you so much for being here and talking about this important topic. What we're going to be doing is setting some context around why we want to talk about this classification of substances, and then beginning to discuss what this classification of substances is and what the impacts of synthetic cannabinoids are on individuals who might be using these substances, and what it might look like if they come into your clinical settings. How do you identify this? What are the resources available to begin to treat this from a behavioral standpoint? And what are potentially some of the symptoms, the presentation, the medical considerations that you might want to be aware of in order to triage and manage the use of these substances? That's our overall plan for the remainder of this session. Please continue to think about questions. Our objectives align with that plan. And again, I'll start by describing broadly what are some of the issues that we're facing in terms of synthetic substances, novel psychoactive substances, and where synthetic cannabinoids fit within that. Ultimately, what I'm hoping that we're able to do is get a better sense of what do we need to know about these substances so that we can initiate conversations, and then what guidance is there, either broadly at a systemic level or individually at an interpersonal treatment level, to begin to manage some of the substance use related behaviors for synthetic cannabinoids. You'll see these terms used interchangeably as we go through. K2 and spice are some of the colloquial terms, some of the slang terms, some of the product terms, the brand names for synthetic cannabinoids. And so we'll move back and forth between that terminology. Know that when we talk about K2 and spice, those are broad umbrella terms that refer to synthetic cannabinoids. And then we'll look at specific examples of those different types of cannabinoids that we will be discussing. And hopefully by the end of this, you'll have one or two strategies or different tools that you might be able to utilize to, at the very least, begin a conversation with a client or a patient, begin an identification of some of these symptoms to better understand what an individual might be using. This is simply a breakdown of the commonly used psychoactive substances that I'm sure all of you are aware of. Just to orient us to what we're discussing, consider that those classifications of substances can generally be broken down into three categories: uppers, the downers, the stimulants, the depressants, and then the all-arounders, the hallucinogens, those substances that fit into potentially a few different categories or produce multiple different effects. As we look at these different substances, again, we recognize that part of the appeal of the substances for individuals, why they use them, why they continue to use them, are these effects that they experience from these different substances. And depending on what somebody is hoping to accomplish, there may be many different substances within a particular classification that would help them achieve that or accomplish that. As we think about the behavioral interventions that come along with managing synthetic cannabinoid use, an important aspect of that is the motivation around use, the purpose of use. If drugs didn't work, people wouldn't continue to use them. And we know that they don't work perfectly in the way that somebody might want, that there are drawbacks, there are impacts, there are impairments that result from substance use. But as somebody comes to use substances, one of the main reasons that they use substances and continue to use substances is because they work. From a substance distribution standpoint, as we think about potentially illicit substance trafficking, illicit substance import, the market around that, certainly the greater an effect that something has, potentially the greater appeal that substance might hold for an individual who's using. This is reflected in the opioid use issues that we're seeing currently in the United States, issues around fentanyl, Some of that is related to the economics of import and the business of substance distribution. Some of it is related to the physiological chemistry of what fentanyl does to an individual. We certainly see that there is an adaptive component to this, and we'll see this with synthetic cannabinoids as well. The emergence of designer psychoactive substances is a trend that has been continuing for, or has been spotlighted for about 20 years now, but it isn't something that has come about in the last 4 or 5 years. These designer psychoactive substances have been around for decades, and we'll look at some of the history related to that. We also recognize that when we're talking about synthetic substances, it isn't just classification of cannabinoids that we have to consider, that there are a whole range of these different categories of substances in which chemical compounds, chemical precursors, chemical substrates are being created and manufactured and distributed in a way that creates a different kind of substance, right? In a way that creates a potentially more potent substance for individuals who might be seeking that out. So we will focus primarily on the cannabinoids, but be aware that depending on where you are, depending on where you're joining us from across the globe, you may be seeing these other designer psychoactive substances appearing, and the speed at which these appear and then potentially disappear makes it really difficult from a forensic standpoint, from an assessment or analysis standpoint, to potentially track and trend what you're encountering within any given community. As we talk about these new psychoactive substances, these designer substances, these are chemically diverse emergent substances in the global drug market. These are subjected to really rapid evolution and chemical changes that result in limited data around the health effects. And so as you all know this, because if you're working in a community setting, if you're working with a population, not solely in an academic setting, you're aware of the trends that occur within those communities and how rapidly they change, how quickly a new substance may appear, and how quickly that new substance may pose a potential threat or impact on public safety, public health, before we have that research foundation to really understand what is this substance, what is its impact, how do we classify this, how do we understand this. And so the analysis, the identification, and really information sharing globally related to monitoring and treatment are essential, especially with how rapidly these new substances emerge. And I feel so thankful that we have such a global audience today, because without this kind of information sharing, this challenge of trying to meet the needs of these rapidly emerging substances becomes that much more difficult. I'm fortunate too, as I mentioned, through UCLA, we have a number of international collaborations that we work on. We regularly have physicians, psychiatrists visiting us from Egypt. We've had individuals come from Thailand, from Indonesia, recently worked with individuals from Korea, and then the project that Verna mentioned that I'm part of, we work closely with our partners across the Pacific. Hawaii, as part of the United States, we also work with jurisdictions including Guam, Palau, Saipan, CNMI, RMI, FSM, and we see that while there are similar challenges related to the use of substances within communities, the type of substance that is used will depend very specifically on the geographical location of that site or of that clinic even. And so having an opportunity to talk individually with providers, having an opportunity to get a sense of what emerging trends are you seeing, how do you use data to potentially inform yourself of those trends, but ultimately be involved in, invested in asking the community, connecting with the community to understand what what individuals in the community are seeing, makes this process of addressing emerging designer synthetic substances, again, potentially more effective. The categories of these novel psychoactive substances are just as broad as we have mentioned previously. These are some of the more emergent substances that have been identified recently within the last 3 or 4 years. Again, synthetic cannabinoids are on this list. We're hearing more about nitazines within the United States, and then certainly fentanyl analogs present a challenge globally. Some of the synthetic stimulants are also being seen across the world, potentially in different trends than what we're seeing in the United States. The risks associated with these novel psychoactive substances, these synthetics, are that they're linked to health problems such as seizures, agitation, aggression, psychosis, in excess of what you might see with the traditional substances, something like cannabis that's organically grown and farmed. You might see a more pronounced health impact, more problems related to some of these symptoms that can result from use. You can see severe intoxication or physiological dependence that results. Oftentimes, we don't know what the risk profile of these substances are, and therefore the safety data around use is not known. And so there is no minimum acceptable or safe amount of use, oftentimes, because of this lack of data. We often don't know about purity and composition unless there's specific spectroanalysis that's being done on a particular substance that has been identified. We won't necessarily know that. And again, a lot of that is dependent upon having the systems and the resources in place to be able to identify those substances, to seize those substances, and then to conduct that research on those substances. Polysubstance use can also increase the risk of hospital admission and death. If somebody doesn't know what they're using, and they've been told that it's a particular type of substance, they may potentially use that substance in the same way that they use other types of that particular compound. So if somebody is used to smoking a certain amount of cannabis, and suddenly they switch suppliers or dealers, or they go to a different shop, and there's a new substance that is available, whether they're told that that substance is the same or not as what they typically use, they're probably going to use that in the same way, in the same amount. We know that individuals who have substance use disorders are highly ritualized in how they use. There's an odd sort of structure that isn't super helpful, that isn't all that conducive to health functioning, but there is a ritualization that comes with substance use behaviors. Because we don't often have comprehensive data around these novel psychoactive substances or these synthetics, one of the best sources of information is user-reported data. And so you'll often see in reports, you'll often see in analyses of these emerging substances, quotations from clients or patients. You'll see information pulled from social media or apps or user reports online, things like Reddit. And this will give us some indication of what the impacts might be, so that not necessarily we take this as the sole impact of the substance, that this is the true diagnostic profile of this substance, but rather we may be able to note this and incorporate it in our behavioral interventions of how we initiate conversations with others, how we ask questions around these substances for which there isn't a standardized screening or assessment mechanism. One particular drug, the drug was not specified. This was a suspected to be a synthetic substance. The individual indicated that it was the worst drug experience that they have ever had. They said it's the most anxiogenic substance I've ever used. And it's interesting to me that somebody is using such a specific clinical term to refer to the development, the generating of anxiety from the substance. It tells me that this person is probably somewhat savvy in terms of they have an understanding of the clinical terminology. Nausea, vomiting, heart pounding like they're going to have a heart attack, and then a little bit of dissociation, a little bit of an interruption in kind of the tracking of time and information. They weren't sure whether they said that, thought it, or read it. 2 hours later, they said they would never take that substance again. Another report, this was a synthetic cannabinoid that the individual identified, calling it the synthetic cannabinoid apocalypse, which outside of this particular report, I haven't encountered in any other way. The individual said they took 3 hits from a small pipe, which is hard to quantify from a dosage standpoint. They said it had an organic taste, like a plant-based taste, something that was more earthy in terms of its profile. No chemical odor or taste. 5 minutes in, they said it felt like cannabis. 10 minutes in, they said it felt like an intense cannabis high. And they indicated that more than 3 puffs, more than 3 hits from that pipe may have been too much. As we talk about these synthetic drugs, again, you'll hear them referred to as spice, bath salts, incense, plant food. Not really that, and we'll come back to that. These are chemically based, not plant-derived substances. They are incredibly complex in their chemical profile. And there's these chemical compounds are sometimes known and sometimes they are unknown. Rogue chemists will change aspects of the chemical profile of these substances ever so slightly in order to stay legal in terms, again, of manufacturing and import or potentially export. There's also in some regions a need to prove intent to use in order to criminally convict use of or holding of these certain substances. That is one component in the United States in terms of customs and border protection that is a loophole that allows these substances to be, again, moved from one place to another. If we look at some of these effects, these effect groups worldwide in 2022, you see that stimulants were the most widely identified group of these synthetic substances, with synthetic cannabinoids being the second most identified. As we look at the trends globally, the number of substances reported, you can see the darker that kind of purple color, the more, the greater number of substances reported within that region. So what's interesting to note here is that the presence of these psychoactive substances across the entire globe, but where there are more substances reported. Now, I'm aware as I look at this that the number of substances reported doesn't necessarily reflect that there is less of a problem in the regions where it's a lighter blue color. It is potentially that those regions have a different reporting system in place, or potentially are still building the capacity, the infrastructure to collaborate with international partners or labs to have mechanisms to identify substances at a certain rate. But again, we're seeing this increase in the number of substances reported, and this being a particular concern across the globe. If you look at the number of substances reported in North America over the last 10 years, again, stimulants are the most widely reported of these, with synthetic cannabinoids continuing to be an issue, continuing to be a challenge in this reporting or in this identification. If you look at the total number of novel psychoactive substances reported each year, there is this general trend of an increase in identification, which again, to me, indicates an encouraging trend that there's a greater focus on building capacity at a systemic level to identify these substances, to build that information base so that at an interpersonal level, at an individual level, I have a better understanding of what I might encounter and what to do about it. You can see the trends and how the trends change in terms of the types of substances. No one particular substance is dominating year to year, besides, I think, stimulants, followed closely again by the synthetic cannabinoids and the synthetic opioids. As we look at the different types of synthetic cannabinoids that have been identified in North America, again, you can see how quickly these substances emerge year to year when they're identified, and then the year that they are scheduled, meaning the year that they are there's a formal policy developed around how to manage that substance. There's a bit of a delay between the emergence of the substance, where it may be a problem within a community, and then the point at which there's policy developed around it, the point at which there's laws developed around it, the point at which there's some infrastructure developed to manage and navigate and to mitigate these chemically complex and rapidly emerging substances. Each of these substances is known to bind to a cannabinoid receptor, and their effects are similar to delta-9 tetrahydrocannabinol, which is the typical cannabinoid product that we might see, something like marijuana or cannabis. These are often laced into herbal products and sold as what we call spice. The Center for Forensic Science Research and Education tracks these emerging cannabinoid trends regularly. This is an excellent resource to stay up to date on information. While it is solely focused on the United States, we'll look at some global resources in a moment. This does help to, again, be aware of some of the trends that are noticed. In the third quarter of 2023, the most widely identified substance that was emerging were benzodiazepines. If we take a look at the most recent data, the first quarter of 2024, you see that while benzodiazepines continue to be an issue in terms of the most widely identified substance via this lab, synthetic cannabinoids are continuing to trend in a direction of increasing as well. We see how difficult this effort to track synthetic cannabinoids is from the chemical structure of them. Looking at the third quarter of 2023, the number of substances identified in that quarter, 3 different types of chemical cannabinoids, synthetic cannabinoids, all found from toxicology reports, not from seized drug materials. Slightly different in the first quarter of 2024, the variety of substances increased, and the number of events or occurrences of synthetic cannabinoids increased as well. So not only are we seeing more of these different chemical compounds, but we're seeing more synthetic cannabinoids overall. This is reflected in the trend data from fourth quarter of 2020 to the third quarter of 2023. Again, to note here how difficult it is to track these trends, how difficult it is to keep up to date on these chemically complex substances that mirror typical cannabinoids. Again, we'll think about some of the resources related to this. These are not the spices that you use to cook. These are not the spices that you have in your cabinet to make a more flavorful dish. It is a slang term to refer to a synthetic compound. And so as we talk about cannabis broadly, cannabis, the slang terms for cannabis, pot, grass, weed, that is a mixture of dried, shredded leaves, stems, seeds, flowers from the cannabis plant, the cannabis sativa plant, the hemp plant. This is the most commonly used illicit substance in the United States. The main psychoactive chemical in this cannabis plant is delta-9 tetrahydrocannabinol, or THC. The effects of THC can vary depending on the type of plant that is grown, the strain as you often hear it. The common effects are euphoria, relaxation, heightened sensory perception, laughter, altered perception of time, and then increased appetite. They can also produce anxiety, fear, distrust. There's research that indicates there's an increased risk of developing psychosis or schizophrenia with use of THC products. The main categories of these products divide into indica or sativa. And again, depending on the plant, depending on how it's grown, manufactured, cultivated, it will have varying effects, but generally speaking, as we think about an indica strain, that's more of a body high, meaning you're getting more of a physiological relaxation. One of the ways that this is referred to among individuals in the United States, indica sounds like in the couch, meaning you're going to lay down because you're going to be relaxed. Sativa has a little bit more of a significant THC component rather than the CBD, the cannabidiol component of an indica strain. The THC will produce more of the head-related high, the euphoria, the altered sensory perception. Generally speaking, that is how those categories separate as we're thinking about cannabis. Now, synthetic cannabinoids are a chemical compound that mimics delta-9 tetrahydrocannabinol. It is a variety of chemical compounds that are sprayed on an herbal mixture. The herbal mixture is inert. It has no chemical effect or psychoactive component to it. It is the chemical spray that is added to, or the chemical additive that is added to these dried plant products that produces the psychoactive effect when this is ingested or smoked. One of the ways that manufacturers get around, again, the import and the sale of these substances is that these products are labeled as not for human consumption, not for ingestion. You can see it potentially if you have really good eyesight, you can see it on that picture of that K2 packet. At the top there, it says not for consumption. And therefore, because it's not being used as an ingested substance, or it's not being sold as such, is one of the loopholes to continue to sell these products. These products are fairly easy to obtain. Again, depending on where you are, it will depend on that community. I know that in certain locations across the Pacific that I've visited, you can go into certain shops and readily obtain these. And here in Los Angeles, you can go into both cannabis shops, you can go into certain gas station shops, and these products are available for sale. In theory, somebody would be asking for identification to purchase these, but that doesn't always necessarily happen. Synthetic cannabinoids are associated with a range of health risks, as we talked about, the neurological effects, psychiatric episodes, physical ailments. These are typically used by smoking. You can also infuse them into tea and drink them. Many of the active chemicals are scheduled or classified by the Drug Enforcement Administration as illegal, but using a slightly altered chemical precursor circumvents that law or that regulation. The other consideration is that because there are multiple generations of these drugs, it is hard to know what somebody may be getting as they're buying a particular product. This packaging also clearly appeals to certain potentially younger individuals. These are colorful packages that have cartoon characters on them. These are packets that were seized by the DEA. These are published on the DEA website to help individuals stay up to date on what substances are available. You see some of these compounds, they are marketed as potpourri. It is not potpourri. I had a younger individual in treatment, this was years ago, who was aware that spice was also called potpourri, that it was something like weed. She ended up rolling and smoking her mom's potpourri from a vase that her mom had at their house. She became very sick, not critically ill. She was throwing up. She had to go to the hospital. She was treated for dehydration. It's not the same thing. Even though it's called potpourri, it's not what you keep in a vase to have your home smelling pleasant. We see that this is a trend among younger individuals. Particularly in the 2010s, this was a major concern among 8th graders, 10th graders, and 12th graders. There was a perception that using these products was harmless and that it would produce a stronger high. During a 2-year period, emergency department visits doubled as a result of synthetic cannabinoid use. Since this time, prevalence has dropped to below 2% on this annual survey that is conducted among 8th graders, 10th graders, and 12th graders, middle schoolers and high schoolers. Because synthetic cannabinoids, the prevalence has dropped so low, synthetic cannabinoids as a category has actually been removed from this survey due to the low prevalence and the concern that respondents were confusing synthetic cannabinoids with vaping when they are not actually the same. Synthetic cannabinoids can induce psychoactive effects. They are readily available in retail stores. You can buy them online. The packaging is highly attractive. It's appealing particularly to younger individuals. They are perceived as safer, and they are not easily detectable in urine and blood samples unless you know which of those varied chemical compounds that you're actually looking for. So we look at some of the data around the impacts of synthetic cannabinoids. Kidney damage has been linked to synthetic cannabinoid use. It was a smaller sample size, but looking at some of the hospital admissions, there were 16 cases of kidney damage reported by the CDC within a 1-year period. 15 of the patients were male. They ranged from 15 to 33. Again, individuals presenting in an emergency department tend to be younger. They tend to be male, related to synthetic cannabinoid use. In one particular case review of 4 of these individuals who presented with kidney damage, these were previously healthy individuals with no co-occurring medical issues. The acute kidney injury was associated with synthetic cannabis use. They presented with symptoms of nausea, vomiting, abdominal pain. All 4 men were able to recover kidney functioning without the use of dialysis. There is no typical user for synthetic cannabinoids. This is true of most substances. Review of literature shows that the most common presentation are males aged 13 to 40, presenting with tachycardia, agitation, nausea, and vomiting. Because both the cannabinoid CB1 and CB2 receptors are expressed in the kidneys, there is a greater concern about the impact of synthetic cannabinoids on renal blood flow and sodium reabsorption. Something like rhabdomyolysis is a presentation that has been linked to synthetic cannabinoid use and other synthetic compounds that we've mentioned previously. Synthetic cannabinoids, again, can decrease renal blood flow through those inotropic effects, the muscle contraction and regulation. I mentioned rhabdomyolysis. As a secondary effect, there can potentially be drug injury that's a direct effect of the substance. And at this point in time, there is no clear antidote for intoxication. There is no clear medical reversal or management of synthetic cannabinoids. There's also evidence that this can lead to dangerous symptoms in pregnant women, including preeclampsia and eclampsia, marked by high blood pressure and high levels of protein in urine. As you all may be aware, preeclampsia can develop into eclampsia, which can cause seizures, coma, and in certain cases, fatality. One particular case example, a woman who was 35 weeks pregnant, suffered a seizure. She was agitated. Upon admission, she had high blood pressure, protein in urine. She was treated for eclampsia. An emergency C-section was performed, just the treatment to address eclampsia symptoms. The woman screened negative for all of the typical drugs that are screened in this health setting. An anonymous caller actually reported that the woman had smoked Spice Gold, a synthetic cannabinoid. This particular type of cannabinoid isn't detected on standard urine tests. You need a specific test for that particular synthetic cannabinoid, which most hospital settings, most treatment settings won't have readily available. From a resource standpoint, it doesn't make sense to carry a number of those different test kits because of how varied these chemical compounds are. The baby did test negative for any substances in their system. The woman was required to go in for psychiatric care and for some symptoms of psychosis following delivery. This was not a pregnancy problem. This was a drug problem. The eclampsia was cured with the delivery of the baby. However, the symptoms did not fully resolve because of what is being attributed to the impact of those the synthetic cannabinoid. The other emerging cannabinoids that are being tracked within the United States and potentially beyond, cannabidiol, it's a butyl analog of THC with a comparable potency to delta-9 tetrahydrocannabinol. You'll often hear about delta-8, delta-10, delta-11 THC. These are designer substances, synthetic substances that are derived from THC, delta-9 THC, the plant-based form of it, that have less potency, typically. Hexhydrocannabinol, THCA, ACRCC, delta-8 THC is, again, a designer substance synthesized from hemp-derived CBD. You may encounter some of these different substances. The Drug Enforcement Agency is working to address these substances as they appear. However, hemp products, the hemp plant, which THC is derived, are not subjected to scheduling unless the THC content in that plant is higher than 0.3%. So you're seeing the emergence of these substances that are derived from the THC in hemp plants, but they are derived from plants that contain less than 0.3% THC content, and therefore circumvent typically the regulations that are in place by the DEA. Tetrahydrocannabinol acetate ester, THCO, is one of these emerging substances that has been shown to have a potency of 2 to 4 times greater than delta-9 THC. User reports online, and when I say user reports, these are shops that are trying to sell THCO, will say that the potency is 10 to 300 times greater. A strong selling point, right, for somebody who might be looking for a more impactful high. There's no research from a chemical standpoint, from an analysis standpoint, that indicates that THCO is that potent. Because THCO does not naturally occur, it does not fall under the classification of hemp. And therefore, because it's a synthetic compound, it is now subjected to THC scheduling. So the DEA has recently clarified that while this is derived from a plant product or a THC product that may meet the criteria for not being scheduled, because it is a synthetic compound, it does rise to the level of falling under scheduling classification. Is there some good news in this? Potentially. We know that the impact of co-ingestion makes substances more impactful. One of the concerns is co-ingestion of fentanyl, co-ingestion of xylazine. To date, as of the most recent data we have, lab reports do not indicate any samples that have cannabinoid products and combined fentanyl. Adulterants or additives raise concerns, but there haven't been too many, if any, adulterants identified in cannabis products to this point. Again, the neurobiological concerns, this impacts the dopamine pathways, which will increase that reward pathway. It'll reinforce that. It's been shown to have impacts on certain brain regions implicated for coordination, problem solving, sense of time, and a possible link to psychosis and schizophrenia. Classic cannabinoids act on the CB1 and CB2 receptors. The anandamide transmitters will bind to those receptors. THC has a low affinity, and it's not very good at inducing those effects. But again, unlike endocannabinoid transmitters, it's not degraded immediately, so CB1 activation is extended or exaggerated compared to endogenous anandamide. Synthetic cannabinoids have no structural similarity to THC. They have a similar profile, they have a higher affinity for those receptors, and they bind more tightly, producing a longer lasting effect. The product of the breakdown, the metabolites, are also psychoactive, meaning that you're more likely to have longer lasting adverse effects. Those effects can include persistent depression, memory problems, difficulty focusing, psychotic symptoms, paranoia, agitation are the main concerns. If you're noticing this, it is important to develop a clinical treatment protocol to get that person to an emergency department. We would treat this as a poisoning, essentially. If it's an unknown substance and the person is experiencing an adverse reaction, we would want to consult whatever regional poison control center we might have. Acute management would consist of the use of benzodiazepines to manage agitation and anxiety, observation to identify vital signs, vomiting issues, and psychiatric symptoms. And then remember, because of variability in chemical structures, it is difficult to predict overdose or toxicity. Call local poison control centers, dial emergency services if needed. Having these numbers available are critical. Some of the additional strategies to address the use of synthetics. We need to have a foundation of how to develop protocols and treatments to identify, disseminate information related to synthetics, utilize existing frameworks that incorporate international, regional, national, and local steps. Having laboratory data can be critically important to identify these substances. The World Health Organization and the UNODC have identified a 4-stage spheres of action to address synthetic use: multilateralism, counter-narcotic intervention, early warning, and health response. So much of this is early identification and information sharing, and then beginning to develop mechanisms to disrupt trafficking. The good news is that globally steps have been taken, specifically in Asia and China, to disrupt the manufacture of synthetic cannabinoid products. And what we've seen is globally a decrease in the total number of reports to the National Forensic Laboratory Information System of these synthetic substances. From 2019 to 2021, the total number of drugs reported decreased. However, the number of drugs increased, the variety of drugs increased, the number of cases decreased. Again, what accounts for this are some of the factors in manufacturing and distribution, law enforcement and laboratory processes, and then potentially some of the issues related to COVID impacts in data collection. Again, the United Nations has a toolkit on synthetic drug management. This is an excellent resource if you are looking to enhance these spheres of action within your organization or your facilities. Website is there. There are a number of resources available to develop brief interventions using traditional screening and identification mechanisms like the ASSIST, like SBIRT. And so I encourage you to take a look at those and to incorporate those where it is useful. Recommendations include outreach, screening and brief intervention, using motivational and behavioral evidence-based treatments, as well as pharmacological treatments for stabilization, and then ongoing long-term residential treatment, rehabilitation, and recovery support services as needed. Consider using a standardized screener. There isn't one for synthetic cannabinoids, but the Cannabis Use Disorder Identification Test, or the QDIT, is the most widely used screening tool for risky cannabis use and has been generally viewed as applicable to synthetic cannabinoids as well. It's 8 questions designed for self-administration. Each item is scored on a 0 to 4 scale with a total score of 32. A score of 8 or more indicates hazardous cannabis use. A score of 12 or more indicates possible cannabis use disorder. There's 8 questions, easy to administer, quick to administer. And then the recommendation is, should you encounter this, refer to specialty substance use services if the individual is in that moderate to severe use range. Some additional resources for you before we open it up for questions. Again, these come from the UNODC, from the World Health Organization. There is a concerted effort at the global stage to identify synthetic cannabinoids and to begin to develop protocols across these different novel psychoactive substances that can be shared in various communities. Even though we may not be experiencing the exact same issue in Los Angeles, we recognize how the challenges that we are facing are faced globally. And this opportunity to come together for unity in our efforts to manage this with our communities and with our patients makes this type of interaction that much more meaningful. Continue to learn, continue to identify resources. that expand upon this information. I know that we could spend so much more time on this than we have already. Please feel free to reach out to me if you have any additional questions. I'm looking forward to a little bit of dialogue in our remaining time and seeing what questions have come up. Thank you all very, very much for your time today. And I think we can go ahead and go to the questions in the chat at this point.
Okay, thank you very much, Andrew, for such a wonderful presentation. We do have questions, and I think one of the first one that we keep on seeing recurring is what are the tests that's used to identify synthetic cannabinoids? I think you mentioned this a little bit earlier, but if you can elaborate, that would be appreciated.
Sure. So much like other laboratory tests that would identify something like fentanyl within a substance, within a compound, there are laboratory tests that can identify certain synthetic cannabinoid compounds. I'm going to go back in the slides just a little bit. I skipped over this because it's in the slide packet. These are the different synthetic cannabinoids that emerge by year. And each of these, while they are chemically similar, each of these is distinct from the other. And so these tests that are produced will identify a certain chemical compound within these synthetics. But again, the challenge in that is you have to know which test you're using. You have to know what you're testing for. And just because you have a synthetic cannabinoid, it doesn't necessarily mean that that synthetic cannabinoid will contain that particular chemical structure that you would be testing for in a laboratory setting. It makes the identification challenging and often delayed. So what emerges on the street in a community may not be identified until sometime later. So again, these are laboratory tests that identify a positive presence of a particular specific chemical compound within this classification of synthetic cannabinoids. And again, the extent to which a lab has that, it will depend on what they're trying to test for.
It seems to be challenging. There's another question with regards to, do we know how long synthetic cannabinoids remain in our body? Do we have that information?
Unfortunately, no. Unfortunately, no. Again, because the variability in these chemical compounds means that there really isn't a standardized biochemical understanding of the metabolization. What the research seems to indicate is that the half-life of this compound, the metabolization of these synthetic compounds, takes longer than your traditional cannabinoid products. Because of the way that synthetics bind to those CB1 receptors and CB2 receptors, it's going to take longer to clear that from your system, and the effects are going to last a little bit longer, which is part of the appeal for a lot of individuals, unfortunately. Good question.
And then the next question has something to do with withdrawal. So what happens during synthetic cannabinoids withdrawal?
So synthetic cannabinoid withdrawal can look a lot like traditional cannabinoid withdrawal. You're seeing more pronounced impacts related to sleep disturbance, agitation, irritability, appetite change, the mood change. Again, that typical cluster of withdrawal symptoms, but more significant. One of the other concerns that has been coming up more recently that some of you may be aware of, CHS, cannabis-induced hyperemesis syndrome, in which individuals who have used fairly potent cannabis products at discontinuation, potentially not at discontinuation, will experience recurrent and difficult to manage, potentially unstoppable vomiting, uncontrollable vomiting. That is an indicator when somebody presents in an emergency department to screen for cannabis or synthetic cannabinoid use. There's a management of that for, again, emesis, hyperemesis, dehydration. One of the recommendations that has been noted also is warm baths or showers seem to physiologically regulate individuals who are experiencing CHS. So that is another one of those more significant impacts that's being seen with synthetic cannabinoid withdrawal.
Okay, so it seems that because the synthetic cannabinoids are very fluid, so most of the information that we have are just emerging and it also keeps on changing. It's easier to tweak
Yeah.
these substances than the natural illicit psychoactive substances.
Correct. And it is one of the most frustrating aspects of dealing with emerging substances is that there oftentimes is not a protocol in place. And once the protocol has been developed, it may not necessarily apply to the next emerging substance. And so one of the best courses of action is to come up with a policy for identification and then rely on existing evidence-based treatments for analogous substances to manage the symptomatology. And so treat what is in front of you, manage and stabilize the individual based on the clinical presentation. And if there's the evidence-based foundation for use of those interventions, that has been shown to be effective for the most part with these emerging substances.
So the next question is a regional one. So can you elaborate on the information or lack of it in African countries as presented earlier? Do we know like the prevalence or if synthetic cannabinoids are readily available in Africa?
If I remember correctly, the data that's coming out of Africa seems to indicate that there's a greater concern related to synthetic stimulants and synthetic opioids. And so while there is some data related to synthetic cannabinoids, it doesn't seem to be the most prevalent of these novel substances that's emerging from that region. I believe there's also been a delay in reporting to some extent because of a lack of inclusion of Africa in some of those global reporting efforts, not because of anything that Africa is doing, but again, the way that these systems are structured and who is typically involved. It seems to, at this point in time, be largely driven by the United States and Asia.
Okay. And then, so speaking of Asia, we actually have a question from Asia in terms of the plans or policies in place to mitigate chemical diversion or use among students. Like, how about the student and the emerging adult population?
In terms of use of these substances?
Mm-hmm. The plans or policies that mitigates the use of substances, if there are any?
Yes, so China is actually, to some extent, leading the way in managing the emergence of these synthetic substances. Again, there are a lot of geopolitical factors that go into those partnerships and how that's managed, which I will not get into. It's not what I do specifically, but they have been driving these efforts to identify these substances as they emerge and to, where they are able to, reduce the manufacturing of these chemical compounds. For a period of time, a lot of the chemical compounds that were added to these dried plant products were emerging from China. You could easily buy these products in bulk online. It would come in a spray canister and you could purchase that as a private citizen fairly easily. Their efforts at a policy level, at a law enforcement level to regulate that have resulted to an extent in a decrease in the number of cases reported, even though there are additional drugs that continue to emerge.
Okay, so what we're seeing is that it seems that most of the policies in place at the moment are focused more on supply reduction side rather than a specific population. Am I
That's
correct?
correct. That's correct. Mm-hmm.
And then for my last question is, this is a question coming from me directly. So personally, what do you consider as the biggest challenge in dealing with synthetic cannabinoids?
I see it as twofold. Well, it's more than that, but if I were to distill it down to two, I see it as twofold. One of which is the speed at which these emerge. It is hard to get in front of that. It is hard to be in a prevention mode with that because of how quickly these emerge. The second is the general attitude around cannabis products and how widely acceptable and available cannabis products are generally. Individuals may or may not know what type of cannabis product they're using, which may make them more susceptible to this kind of accidental poisoning, to using a substance that they think is safe but may not be. So I see this interchange between some of those more broadly geopolitical, systemic issues that are related to production and manufacturing. And then I see really at an interpersonal attitude level, the perspective on cannabis makes this a very challenging conversation.
Okay, so thank you very much for a wonderful presentation. So I see DDR would like to thank Mr. Andrew Kurtz for sharing his expertise and all of you for attending our webinar. A copy of his presentation will be shared and it will be emailed to all registered participants. And at the same time, we would like to invite you to our next webinar on August 21 on Insights to the Global Addiction. To know more about our upcoming events, please follow us on social media or enroll in our mailing list. So again, we bid everyone a good evening, good day, good morning, wherever you are in part of your world. And thank you for being here with us. Andrew, thank you so much and have a good day.